Bismillahirrahmanirrahim. Assalamu alaikum student. Today's topic is multiple pregnancy. As the name indicates that the fetuses are more than one in the uterus of the mother. Frequency of multiple pregnancy is about 3% in United States and of the twins is 32.6 per thousand births in 2008. Rate of twin pregnancy increases as the age of the mother increases, fertility treatments, and due to the assisted reproductive technologies. So these three factors increase the risk of multiple pregnancy as well as twin pregnancy. If there are three fetuses, then you can say the triplets, and triplets incidence is about 1 per 76,000 per birth. Birth of quadruplets, quintuplets, and so forth is rare. Coming to the twins, when we are having two fetuses in the uterus, the incidence of the dizygotic twins is 90%. When we are talking about the twins, twins are of two types: dizygotic twins and monozygotic twins. Dizygotic twins and monozygotic twins. First, we will study the dizygotic twins. These are the twins whose incidence is 90% and incidence increases with increase in age, and it will be double at 35 years of age, and assisted reproductive technologies will also increase its incidence. As you can see, di means two, zygotic, zygote, we are getting two zygote in these twins. So we have two sperms and two oocytes for fertilization in the uterine tube of a mother, and from these we will get two zygote to implant independently. As there are two zygotes and these two zygotes have different genetic constitutions, the twins have no more resemblance than any other brothers or sisters. These zygotes, which we will get from two sperms and two oocytes, will implant independently. They have own placenta, amnion, and chorion. Red blood cells of two fetuses may be of different types. If there is the fusion at the corners or edges of the placenta, red cell exchange can occur, then this is called erythrocyte mosaicism. You can come to know that as zygotic twins, how these develop. In this diagram, you can see that by one sperm and one oocyte, we will get in this zygote, and the other sperm and oocyte will give another zygote. These two zygotes will form the blastocyst same, and this blastocyst on reaching the uterus will implant within the wall of the uterus independently. And when they will grow, maybe there will be the fusion of the placenta, but it is not necessary. They are developing so that they have their own amniotic cavity, their own chorionic cavity, their own placenta. So they are growing independently of each other. So this is about the dizygotic twins. Di mean two, zygotic means zygote. So in this we have the two zygote, and two zygote we can get from the two sperms and from two oocyte. So they are similar to the single pregnancy, but they are two fetuses growing in one uterus. Difference is only of this in dizygotic twins. Now come to the monozygotic twin. Come to the monozygotic twin. Mono means one, zygotic means zygote. Here we are getting one zygote. So we have the single fertilized ovum, and chances of it are 3 to 4% per thousand births. Monozygotic twins result from splitting of zygote. Splitting of zygote at various stages of development. These various stages are two-cell stage, early blastocyst stage, so that inner cell mass divides into two, bilaminar germ disc stage, just before the appearance of primitive streak. So you have to write this: number 1, two-cell stage; number 2, early blastocyst stage, so that inner cell mass divides into two to develop into two fetuses. Bilaminar germ disc stage divides into two just before the appearance of primitive streak. So when they will develop like this, that if the division is two-cell stage, they will behave like the dizygotic twins, that each fetus will have its own placenta, own chorionic sac, and own amnion. So we have the two fetuses, so the two placenta, two chorionic sac, and two amnion for every fetus. But in case of the early, when the division is at the level of the early blastocyst stage, so that inner cell mass divides into two, they will share the placenta and chorionic sac but have two amniotic cavities. So early blastocyst stage, so that inner cell mass divides into two to develop into two fetuses, they will have their own amniotic cavities, but they will share the placenta and chorionic sac. Number 3 is the bilaminar germ disc stage, just before the appearance of primitive streak. They are sharing all the placenta, chorionic sac, and the amniotic cavity. You can write this table like this: that placenta, chorionic sac, and amnion on one side, and at the level of the two-cell stage we have the two placenta, two chorionic sac for the two fetuses, and amniotic cavity for the two fetuses. Early blastocyst stage, so that inner cell mass divides into two, we will have one placenta, one chorionic sac for the two fetuses, and two amniotic cavities for these two fetuses. And when they are going to divide at the level of the primitive streak, bilaminar germ disc stage, just before the appearance of primitive streak, then they are sharing the placenta, chorionic sac, and amniotic cavities. In this diagram, you can appreciate then that when we first stage, that is going to divide into at the two cell stage. Here you have memorized that two cell stage. When they will divide into two cell stage, they will develop two blastocysts. So these blastocysts will develop independently, and they will develop just like the dizygotic twins. The two fetuses with independent placenta amnion, and chorionic cavities. The second stage is that early blastocyst stage. So that early blastocyst stage, so that inner cell mass divides into two. Here we have the blastocyst single, and inner cell mass will divide into two fetuses, so that we have their own amniotic cavity, but they are sharing placenta and chorionic cavity. They are sharing placenta and chorionic cavity, but their own amniotic cavity, you can see. C is that we are going to divide the bilaminar germ disc before the bilaminar germ disc before the appearance of primitive streak. So that they will develop into within the single amniotic cavity, single chorionic cavity, and they will share with each other one placenta. So this is about the monozygotic twins. As they are developing from the single zygote, the two can be recognized as partners of a monozygotic pair by their strong resemblance in blood groups, fingerprints, sex, and external appearance such as eye and hair color. This is all about the multiple pregnancy, and these are the roll numbers 51, 52, 53, 54, 55, 56, 57, 58, 59, 60. They will make the assignment of the multiple pregnancy. Thank you. Allah Hafiz.